One of the things that makes me unique compared to some other physicians is I've been the patient a lot. Unfortunately, I've had 23 surgeries, and so I have a very unique perspective, and I've been the patient a lot. I've had to recover from a lot of injuries and surgeries, so I know exactly what patients are going through. I know what they're going through physically. I know what they're going through mentally. So I have a different amount of compassion than I think most people do. One of the frustrating things about these types of injuries is that you really can't see them. So sometimes the people's spouse or their significant other won't understand how much pain you're in, and unless you've been through it, it really is hard to understand. And sometimes what I'll do is have the patient bring their spouse or significant other in so that I can explain it to them so they really do understand what they're going through, because I'm trying to make them become a support group for them rather than sort of working against them. One of the unique things about us at Injury Treatment Solutions is that it's just not a chiropractic office. In fact, chiropractic is just a small part of it. We have basically everything conservative under one roof. We've got medical doctors, we've got physical therapy, and then we have chiropractors. What chiropractors do that makes them unique is what's called manipulation, which is a realigning of the spine. But we only do that if it's necessary. Not every patient gets chiropractic treatment. Sometimes it's just physical therapy, sometimes it's dealing with a medical doctor. Most of the time it's a team effort. One of the things about going to a chiropractor is chiropractors have to learn to be good doctors first and good chiropractors second. And what I mean by that is, if you go to a podiatrist with a problem, they're typically going to find a foot problem. If you go to a dentist, they're going to find a tooth problem. If you go to a chiropractor, they're probably going to find something to crack. And really, that's not the way we operate. What we need to do is first figure out what exactly is causing your problem, and do you even belong here? If you don't belong here, we need to get you to the right specialist. If you do, well, I should be able to do that in my sleep. We know how to do those treatments. But really, the idea is to spend the first 10 minutes with a patient and try and figure out if there's a reason not to treat them. In addition to having a lot of different types of doctors at Injury Treatment Solutions, we also have a lot of diagnostic testing, and each has its own purpose. For instance, x-rays. We basically will not treat patients without x-rays. There's only a couple of rare instances. A pregnant woman, obviously we can't take x-rays, but we change how we treat to make sure that it's absolutely safe for both the mom and the baby. The reason to take x-rays is to figure out if there's a reason we shouldn't be treating you. Is there a fracture? Is there a tumor? Is there something going on that we need to be aware of that means doing the treatment we do would be dangerous? Besides normal or static x-rays, we have some other types of x-rays here at the office as well. The reason is that when you take a normal x-ray, you're told take a deep breath and hold still. Well, the problem is most people don't hurt when they're still. They hurt when they do things or when they move. So we have something called a motion x-ray. It's essentially a video, like as if you took it with a camcorder, only we're looking inside. So we're looking at the bones just like an x-ray, but we're going to have you move and do the things that hurt so we can see what's happening to your spine when you're in pain. And that clues us into where your injuries are and what's going on and what we need to treat. It's a unique test. I don't think anybody else has it. It's very expensive, but because it's such a good tool, we have it here.